Maxillary major connectors? A major connector is the component of the partial denture that connects the parts of the prosthesis located on one side of the arch with those on the opposite side. There are several designs for the maxillary and mandibular major connector, and each serves for certain purposes. Special structural requirements for maxillary major connectors. Beading. All maxillary major connectors should display minor elevations at those borders that contact the palatal soft tissues. The elevations are termed bead lines and are intended to slightly displace the adjacent soft tissues. This displacement produces a 1. Mechanical seal and prevents food particles from collecting under the major connector. In addition, 2. These elevations provide excellent visual finish lines for technicians who finish and polish removable partial denture frameworks. Bead lines are created by carving shallow channels on the surface of a maxillary master cast before duplication and investment material. These lines are best prepared with a small spoon excavator or round bore rotating at slow speed. Each channel should have a width and depth of 0.5 to 1.0 millimeters. The depth of the beading should be reduced in areas of thin tissue coverage such as the mid-palatine raphe or a palatal torus. Relief should not be used under a maxillary major connector except in the presence of a palatal torus or a prominent median suture line. The intimate contact between the palatal soft tissues and the metal connector enhances the retention and stability of the denture. Types of maxillary major connector. 1. Single palatal bar. 2. Single palatal strap. 3. Anterior-posterior palatal bars. 4. Horseshoe U-shaped palatal connector. 5. Combination anterior and posterior palatal strap type connector. 6. Palatal plate type connector. 1. Single palatal bar. The palatal bar is a narrow half-oval with its thickest point at the center. If used, the palatal bar should be limited to short-span Class 3 applications, replacing 1 or 2 teeth on each side of the arch. In addition, the palatal bar should not be placed anterior to the second premolar position. Otherwise, its bulk may produce noticeable discomfort and alteration of speech. Single palatal bar major connector. Disadvantages of the single palatal bar? To provide the necessary rigidity, a palatal bar major connector must be bulky. Consequently, patients find the palatal bar uncomfortable. Moreover, because of its narrow anteroposterior width, a palatal bar derives little vertical support from the bony palate. As a result, a palatal bar major connector must derive ventrally all of its support from rests on the remaining teeth. 2. Single palatal strap. The palatal strap consists of a wide band of metal with a thin cross-sectional dimension. The anteroposterior dimension of a palatal strap major connector should not be less than 8 mm to avoid compromise of its rigidity. Advantages of the single palatal strap. Because the palatal strap is located in 2 or more planes, it offers great resistance to bending and twisting forces. This theory is similar to the L-beam principle used in building construction. Simply stated, forces transmitted on different planes are responded more easily. Because the palatal strap is inherently strong, it can be kept relatively thin. Since this configuration offers little interference with normal tongue action, palatal strap major connectors are well accepted by patients. In addition, the increased tissue coverage helps distribute applied stresses over a larger area. Disadvantages of the single palatal strap? In some cases, a patient may complain of excessive palatal coverage. Frequently, this complaint can be traced to improper positioning of the strap borders. Therefore, the interior border of the major connector should be positioned posterior to the palatal rugae if possible. If this is not possible, the interior border should be terminated on the posterior slopes of prominent rugae. The posterior border of the major connector should be positioned anterior to the junction of the hard and soft palates. The increased soft tissue coverage associated with the wide palatal strap also may predispose the patient to papillary hyperplasia. This condition is seen when the partial denture is worn 24 hours a day and normally is accompanied by poor oral hygiene. In many cases, the occurrence of papillary hyperplasia may be traced to inadequate patient instruction. Therefore, it is essential that each removable partial denture patient be provided with thorough oral and written instructions regarding the wear, care, and cleaning of oral prostheses. Note: to differentiate between a palatal bar and a palatal strap, a palatal connector component less than 8 mm in width is referred to as a bar. 3. Combination anterior and posterior palatal bar type connectors. The anteroposterior palatal bar displays characteristics of palatal bar and palatal strap major connectors. Combination anterior and posterior palatal bar type connectors. The anterior bar is relatively flat. Its cross-sectional shape is similar to that of a palatal strap. Borders of the interior bar are positioned on the appropriate slopes of prominent rugae, thereby allowing it to blend with the contours of the anterior palate. The posterior bar is a half oval. Similar to the palatal bar major connector, the two bars are joined by flat longitudinal elements on each side of the palate. This configuration gives the effect of a circle and is considerably more rigid than any of the individual elements. The two bars, lying in different planes, produce a structurally strong L-beam effect. Advantages of the anteroposterior palatal bar. As previously noted, the main advantage of an anteroposterior palatal bar is its rigidity. The anteroposterior palatal bar minimizes soft tissue coverage, yet provides exceptional resistance to deformation. Disadvantages of the anteroposterior palatal bar? The anteroposterior palatal bar is frequently uncomfortable. The bulk and contour of the connector may be bothersome to the tongue and may interfere with phonetics. Moreover, because of its limited contact with the palatal tissues, the anteroposterior palatal bar derives little support from the bony palate. Consequently, its use may be contraindicated in patients with reduced periodontal support. As a general rule, the anteroposterior palatal bar should not be considered the first choice for a maxillary major connector. It should be selected only after other choices have been considered and eliminated. 4. Combination anterior and posterior palatal strap type connector. The anterior-posterior palatal strap provides maximum rigidity and minimum bulk. It may be used in almost any maxillary partial denture design. This major connector is particularly indicated when numerous teeth are to be replaced, or when a palatine torus is present. Each strap should be at least 8 mm in width and relatively thin in cross-section. Borders of the major connector should be kept 6 mm from the free gingival margins, or should extend onto the lingual surfaces of the remaining teeth. Palatal borders should exhibit smooth, gentle curves. When anterior teeth are not being replaced, the anterior strap should be in the farthest posterior position possible. Appropriate placement promotes patient comfort and minimizes interference with speech. The posterior strap also should be in a posterior position, but should not contact the tissues of the movable soft palate. The open area in the palatal region should be at least 20 x 15 mm. Otherwise, another type of major connector should be chosen, e.g., wide palatal strap, complete palate, modified complete palate. The posterior palatal strap should be flat and a minimum of 8 mm wide. Posterior palatal connectors should be located as far posterior as possible to avoid interference with the tongue, but anterior to the junction of the hard and soft palates. The only condition that prevents their use is an inoperable maxillary torus that extends posterior to the soft palate. The strength of this major connector design lies in the fact that the anterior and posterior components are joined together by longitudinal connectors on either side, which form a square or rectangular frame. Each component braces the others against possible torque and flexure. Flexure is practically non-existent in such a design. Advantages of the anteroposterior palatal strap. The anteroposterior palatal strap is a rigid connector that derives good support from the tissues of the hard palate despite its open design. The wavy contour of the metal over the rugae adds strength to the connector and allows the metal to be made relatively thin, 1 mm. The structural encirclement produced by the anterior and posterior straps contributes to the rigidity of the connector. The shape of this connector also provides a definite L-beam effect, thereby increasing the resistance to flexure. Disadvantages of the anteroposterior palatal strap. Even though the metal over the rugae area may be thinner than in some other major connector, interference with phonetics may occur in some patients. In addition, the extensive length of borders may cause irritation to the tongue. Characteristics and location of anteroposterior palatal strap. Rectangle-shaped and open in center portion. Relatively broad, 8 to 10 mm, anterior and posterior palatal straps. Narrow lateral palatal straps, 7 to 9 mm parallel to curve of arch. Minimum of 6 mm from gingival crevices of remaining teeth. Anterior palatal strap. Anterior border not placed farther anteriorly than. Anterior rests and never closer than 6 mm to lingual gingival C. Follows the valleys of the rugae at right angles to the median palatal. Suture. Posterior border, if in rugae area, follows valleys of rugae at right. Angles to the median palatal suture. Posterior palatal connector. Posterior border located at junction of hard and soft palates and at right angles to median palatal suture and extended to hamular notch areas on distal extension side. S. Anatomic replica or matte surface. 5. Palatal plate type connector complete palate. The complete palate provides the ultimate rigidity and support. It also provides the greatest amount of tissue coverage. Hence, the need for maximum support and rigidity should be determined before this connector is selected. As noted for other types of major connectors, the anterior border of a complete palate must be kept 6 mm from the marginal gingivae, or it must cover the cingula of the anterior teeth. Advantages of the complete palate. Complete palatal coverage is advantageous when all posterior teeth are to be replaced. Complete palatal coverage also may be indicated when the remaining teeth are periodontally compromised. In such applications, the vertical support provided by a complete palate can be extremely beneficial. Complete palatal coverage permits distribution of applied forces to the remaining teeth, as well as to the palatal fissures more of the hard palate dot. This type is also named anatomic replica palatal major connector. The palatal plate may be used 1. As a plate of varying width that covers the area between two or more edentulous areas. As a partial or complete cast plate that extends posterior to the junction of the hard and soft palates as an anterior palatal connector with a provision for extending an acrylic resin denture base in a posterior direction, and this can be used when future relining is anticipated. The palatal plate should be located anterior to the posterior palatal seal area. The maxillary complete denture's typical posterior palatal seal is not necessary, with a maxillary partial denture's palatal plate because of the accuracy and stability of the cast metal. 6. U-shaped palatal connector, horseshoe connector. The horseshoe connector consists of a thin band of metal running along the lingual surfaces of the remaining teeth and extending onto the palatal tissues for 6 to 8 millimeters. The medial borders of this connector should be placed at the junction of the horizontal and vertical slopes of the palate. Rigidity can be increased by extending the borders slightly onto the horizontal surfaces of the hard palate. The connector should display symmetry and should extend to the same height on both sides. All borders of the connector should be gently curved and smooth. From both the patient's standpoint and a mechanical standpoint, the U-shaped palatal connector is the least desirable of maxillary major connectors. Disadvantages of the horseshoe connector: when vertical force is applied to one or both ends of a horseshoe major connector, there is a tendency for the connector to flex or deform. A horseshoe major connector has tendency to flex or deform when a load is placed. Therefore, it is a poor choice for most maxillary applications. Therefore, it is a poor choice for distal extension partial dentures. For the same reason, this is not a good connector when cross-arch stabilization is required. The horseshoe connector displays limited resistance to flexing, and noticeable movement can occur at the open end. This may result in the concentration of forces and damage to the associated abutments. To avoid the tendency to flex, the metal crossing the anterior palate must be thicker than that used in most other major connectors. This places the greatest bulk of metal in an area that is critical to patient comfort and phonetics. The U-shaped palatal connector should never be used arbitrarily and may be indicated when a large inoperable palatal torus exists, and occasionally when several anterior teeth are to be replaced. The following are the principal objections to use of the U-shaped connector that may lead to failure of many maxillary partial dentures. 1. Its lack of rigidity can allow lateral flexure under occlusal forces, which may induce torque, or direct lateral force to abutment teeth. 2. Doesn't provide good support and may impinge underlying tissue when subjected to occlusal loading. 3. Increase in thickness at the rugae area to enhance rigidity may interfere with the freedom of the tongue. A U-shaped major connector may be made more rigid with multiple teeth-supported rests and a wider coverage of the major connector. Review of indications for maxillary major connectors. 1. The combination anterior-posterior connector design may be used with any Kennedy class of partially edentulous arch. It is used most frequently in classes EL and IV. 2. 3. The single palatal strap is used more frequently in Class 3 situations. If the periodontal support of the remaining teeth is weak, more of the palate should be covered. A wide palatal strap or a complete palate is indicated. 4. The palatal plate type or complete coverage connector is used most frequently in Class 1 situations. 5. When anterior teeth must be replaced, an anteroposterior palatal strap, complete palate, or horseshoe major connector may be used. 6. The final selection must be based on modifying factors such as number and location of missing posterior teeth, periodontal support of remaining teeth, type of opposing occlusion, and presence of torus. If a torus is present and is not to be removed, an anteroposterior palatal strap or horseshoe major connector may be used. Final selection must be based on modifying factors e.g. size, position, extension of torus,